Come on. Good girl. There you go. I've got a husband, I've got a child, I've got about 13 odd voices that I hear and sometimes speak to. It's quite busy, really. My experience in the mental health treatment system was that the aim was to get rid of the voices, and we were working on coping strategies and stuff, but it was obvious that the voices weren't meant to be there. They're a symptom of an illness, and if we can't get rid of them, we'll cope with them, but ideally they should be gone. I really lost my sense of humanity. It's kind of like being in the middle of a really dark forest and feeling like a monster. And then someone goes, it's not you that's the monster, you've got this illness. The illness is the monster, and we have the cure. We can get you back on track. But it was soul-crushing at the same time. It was like a cycle of never-ending hospital walkthroughs where I just go through the door and feel like I've failed again because I've not lived up to this idea of recovering, and everyone stopped talking about hope and recovery and started talking about cognitive decline and the effect of relapse on my brain, sort of toxicity of psychosis and long-term care. And yeah, I felt inhuman. Within the Hearing Voices approach, it's more this case of, okay, so people hear voices, great. It's just based on a completely different way of seeing voices and visions. It's the relationship between the person and the voices that's the key here, and I was completely disempowered and terrified of hearing them, so I struggled to even talk about them. And what the group gave me was the sense that I can do something, that I can have some agency in that relationship, and I can start to call the shots, and that took quite a while. Like I was going for a good few years, but it transformed things, so it allows me to be healthy and hear voices. Like, voices have not been a problem for me for years now.
The way that I view it, and I think the way that other people in the Hearing Voices network speak about it, is that we view the phenomena of hearing voices and being in that sector of experience as being a natural human variation, in the same way that being colourblind would be, or being left-handed. There's a large percentage of people in the population who hear voices and have these sort of unusual, non-shared sort of beliefs, who are not considered in any way by medical science to be mentally ill. And so that in itself, to me, is enough proof that the experience in itself, the symptom in itself, is not an illness.
Through going to the Hearing Voices group, I started to understand that my experiences had a value that I'd never thought about, that I can use my experiences to kind of connect with and support other people. That was huge for someone like me who'd been basically written off as a user of services, you know, who needs support, that's vulnerable, that needs home care to come in twice a day to make sure I eat and make sure I brush my teeth and take my meds, that I could actually use my stuff to be of benefit to the world. Ended up becoming a mental health trainer.
So it's quite the beginning of a revolution, I think. So we have a system that was designed for a medical way of treating mental distress, with clinics and set forms and diagnoses and so on. You'd be quite familiar with that. Open dialogue, I think, is very much trying to say, how can we meet the human that's in distress, and how can we have more human relationships? You're trying to change a system that's been established for a very long time. So changing that, becoming more flexible, becoming more transparent, becoming more, even more kind of collaborative, that really does involve a shift in, you know, how comfortable or uncomfortable we might be feeling as mental health professionals.
It's a process, and it's natural for people to be a bit suspicious of new ideas, even though this has legs from back into the 80s. It still feels very new. It's more about helping people work more according to their values. I don't meet the official categorisation of recovery, but like you'd be hard pushed for looking at my life and saying that there's an issue with it. You know, got stuff like everyone else, but it's not really, it's not worth worrying about too much.